I'm Carla Tuzzolino. This is my second lower extremity video for manual therapy of the extremities. This is my model Deb, and we're working over here on the right leg. So we're going to start off with the hip. In the patient scenario, the patient has had the ORF to the femur, and so now it's healed. Makes me a little bit nervous, I'm not going to lie, about doing mobilizations on a femur that was fractured, but supposedly it's healed up great now. And we're going to try to gain some just general mobility by doing an inferior glide. So I'm going to put her leg in a position of about 90 degrees flexion here. I don't want her hamstrings to be on stretch, so I'm going to keep it kind of low. I'm going to put my hands in here close to the joint line. In the scenario, she's not having really too much pain, 3 out of 10, so we should be able to, once we assess the joint, we should be able to go through to the grade 3 and grade 4 to really gain some good mobility in the hip. So grade 3 would be through up until the point of resistance, so you're doing those oscillations all the way through. And then at 4 would be at the end, at the point of resistance, and then a small amplitude oscillation. I'm just trying to kind of open that up a little bit. Okay, moving into the hip gapping, we can do this with a mobilization belt, which I don't have, so personally I just wanted to try it kind of without. So I'm gonna kind of come in here to her hip. I'm going to get my hands into the joint line, pretty close up in here, Deb. Sorry, I'm just trying to get into the joint line here. And I got to do something different with your leg. Okay, and so I'm going to just kind of, I'm trying to think about the angle of the femur in the acetabulum, so I'm kind of going in a little bit of that motion. Again, she's mostly stiff here in the hip, not painful. So we should be able to go into the grade 3, and then at the end of the motion, grade 4. Okay, we're going to move ahead to the, I'm going to try to keep Deb in supine for the ones I can do supine, and then I'll switch her over to prone when I need her to be. So we're moving ahead to the knee. We're going to do an anterior-posterior glide of the knee joint. So I'm going to have this towel under her calf and kind of have her knee bent to about 20 degrees. I'm kind of bringing her into that position there so that I can get right in here on the joint and just really kind of assess the motion in that joint. She's got a good amount of play. Deb has a little bit of hyperextension normally, so she's got a good amount of motion in her joint there. But if I was trying to gain some flexion, which the patient in this scenario needs, I would, I'm going to put her in this position, and I'm going to concentrate on the grade 3 and grade 4. Again, there's stiffness in the knee, not pain. So I would go into the grade 3, which would be through the motion, up to the point of resistance. And then I would go to the point of resistance and do a small amplitude, grade 4. Okay. Also, we could do, while we're here, we could do some patellar mobilizations, because I'm sure that her patella is kind of stiff after the femur fracture and having that scope done to her ACL. So I would come on either side here of the pole of the patella and try to get in on that. And if I was going to be doing a medial rotation, trying to kind of scoop up the patella and just kind of glide it medially, so it'll be on the lateral aspect, and I would be trying to roll it kind of medially. Okay, and again, I could go through that motion pretty good. I could impart a little bit of a medial rotation on it too there. And then grade 4 would be at the end range. Is that okay, Deb? Mm-hmm. Got to be careful that you're not kind of grinding down. You want to be trying to kind of lift it up as you're rolling it. Okay, so that would be the medial one, and then you also can do an inferior or caudal glide. So same kind of thing. I'd be here on either side of this the patella, and I'd be mobilizing kind of in the downward direction, inferior. Okay, so we're just kind of here. I could come on this way too and try to go in the grades 3 and grade 4, so to the point of resistance, and do some small amplitude in grade 4. Okay, so now what I'm going to do is I'm going to have Deb turn over onto her tummy, and we can do some of these mobilizations in prone. The first one, we're going back to the hip and doing one in that position. That's going to be the posterior anterior glide. So I'm going to kind of bring her leg up into the 90-degree position. I'm going to try to get as close as I can onto the joint line here. And I'm going to kind of have her leg like this here. And I'm kind of just going to be able to do a little I can do a little bit of a hip extension, but I'm going to come in here on the joint line, and again it would be a grade 3, and then at the point of resistance a grade 4. Okay, I'm going down to the knee. The one that I wanted to do on the knee in prone this is be kind of the one where we're doing a little bit of physiological motion with it too. So I'm going to be coming here. I'm going to be putting her knee or her thigh up on a towel roll, like so, and then their knee hanging off. And then I'm going to be coming in here and doing kind of a distraction, and then with a little bit of a flexion. So since she's missing some flexion in her knee, this will be a good one for her to do, for me to do with her. Here, and then a flexion, physiological flexion with that distraction. Or you could do the distraction with the mobilization just in that motion there with the 3, or you could go down to a 4, small amplitude once you get to that point of resistance where she's at. Okay, so we're moving along to the ankle, and we're gonna start here with the hands of distal to the tib fib, and I'm gonna be doing that posterior to anterior glide. Okay, so I'm kind of coming in on here, and she's painful here in the ankle from the ankle sprain. So we'll probably just do kind of a more gentle 1 and 2 glide. So we're going to be coming from the posterior here to anterior and just doing a gentle glide. You're going to see she kind of gently glides into plantar flexion there with that. 1 or 2. And then we also could do the opposite here. We could come in from the anterior and go to the posterior. And we'll see that that kind of puts her into a gentle dorsiflexion position. And again, we're gonna have to be pretty gentle with these on Deb because she's painful. As she becomes less painful, we can move along to the more aggressive grades that end up giving her a little more motion. So, and then the last one we would do is stabilize her calcaneus, and I'm going to work on to help her with an E version. So I would stabilize the calcaneus, and I'm going to just kind of help with mobilizing her into a little bit of E version here. So there, my hand here is stable. This hand is stable. Here I'm mobilizing her this way. So that's for E version. Okay, so kind of rushed through a little bit. I hope that was enough, and I think we're done. Thank you.